Hi, today I'm doing my PowerPoint over niacin or vitamin B3. I hope that you're able to learn something new and I hope that you enjoy learning about it. All right, so this first slide that I includes sources and forms of niacin just because I feel like they're super important for our career fields. The best sources include meats and fish. And the next best sources include enriched cereals, bread, whole grains, seeds, and legumes. And then I pose the question of if bacteria produce niacin, and they do in the form of nicotinic acid. However, the amount is not confirmed, and so we're not able to put that production toward our RDAs. And then the forms of niacin come in nicotinamide, which is from animal sources primarily, nicotinic acid from plant sources, niacin is actually niacin that is bonded to peptides, and then niacinogens, which are niacin bound to complex carbohydrates. Okay, so we're going to start touching on some health-related topics that include niacin. And so the first one I wanted to cover was dyslipidemia, which is having high cholesterol levels, specifically LDL and low HDL. And the way to treat this with niacin is to ingest greater than 100 times the RDA, which I will remind you is 14 to 16 milligrams. By doing this, we decrease the triglyceride synthesis by inhibiting hepatocyte diacylglycerol acetyltransferase, which is the enzyme needed for triglyceride synthesis. And when we do this, we increase HDL levels by 10 to 30%, and we decrease LDL levels by 10 to 25%. Now, can we do this to treat cardiovascular disease? We can decrease the risk of cardiovascular disease by decreasing the risk of atherosclerotic plaque. However, the adverse effects of niacin include flushing, which can be really uncomfortable for patients. So a lot of medical professionals will opt to use statins instead, just to decrease the adverse effects. All right, so now we'll be covering skin health using niacin. We can use niacin in the forms of nicotinic acid or nicotinamide. Nicotinamide is going to be the topical treatment, while the nicotinic acid is typically ingested. Is one more beneficial than the other? Well, nicotinic acid can directly bind to the nicotinic acid receptors of the skin, but it does increase the risk of the adverse reaction of flushing, as we discussed in the previous slide. So some might opt for the nicotinamide instead. The mechanisms of niacin, it increases NADPH, improving antioxidant capacity of the skin. It also improves the epidermal layer by synthesizing ceramides. And the ceramides are a lipid layer that just provide protection to your skin. And then it also inhibits the yellowing of skin as we age by inhibiting the oxidative processes of the skin. It decreases the risk of fine lines and wrinkles by increasing dermal collagen and protein production. And then it also decreases hyperpigmentation risks by reducing melanosome transfer. Next topic I'll be covering is nervous system health in terms of niacin, and this is a really big topic in the discussion of niacin. The pathway that I'll be covering in this slide is the tryptophan kynurenic acid pathway. This is the pathway that metabolizes tryptophan to NAD, so an important pathway. It produces serotonin and melatonin, which is good, but if NAD doesn't work properly in the negative feedback system to stop this pathway from continuing, then we can also get a buildup of excitotoxins, which is not a good thing. And so one of the excitotoxins that I wanted to cover was quinolinic acid, as it's one of the most toxic intermediates of the KP pathway. The quinolinic acid is a nicotinamide precursor from methyl aspartate, and it's typically present in increased amounts with neuroinflammation, neurodegeneration, and also when mood disturbances are taking places. So we can tell that this isn't something good that's happening. We want that NAD to produce negative feedback for the tryptophan kynurenic acid pathway to decrease the chances of inflammation in the central nervous system. Now we'll be discussing cell health in terms of niacin. The pathway I chose to discuss was the poly-ADP ribose polyamorase pathway, also referred to as PARP, which is what term I will be using. So NAD is a substrate for PARP, and PARP is an enzyme that is used to repair damaged DNA. So we want PARP. However, if we use too much NAD to repair this damaged DNA through this pathway, we get cell death and also decreased ATP production, which is something that we don't want. A major cause of this cell death is apoptosis-inducing factor, which happens when we don't have enough NAD in our mitochondria. When we get adequate intakes of nicotinamide, we replenish our NAD stores, and then we can repair DNA as normal. So we want to make sure that we are meeting our RDAs for niacin. Nicotinamide also increases neuronal survival rates. It prevents ATP depletion, it helps in lipid peroxidation, and it plays an anti-inflammatory role as well as preventing apoptosis. So again, I just want to reiterate, it is very important for us to be meeting our niacin RDA. The image I've included here is this pathway that we've discussed in this slide, and so at the top you can see the DNA is damaged, and it can go one of two ways. It can go to the PARP pathway, or it can go to where we don't have enough NAD to produce the PARP, which results in the DNA not getting repaired and instead leading to apoptosis. But with the PARP on the left side, we have enough NAD, and this allows us to repair this damaged DNA, and then we get the proper fixed DNA. Okay, so this slide is going to be covering brain-derived neurotrophic factor tropomyosin-related kinase B. Super long name, good luck saying it. This axis regulates neuronal migration and also controls synaptic function and synaptic plasticity. It's also used to support neuron survival and axon growth after injury. So this is really beneficial to us if we can get enough niacin to make sure that it's able to do its job. And so there are studies that have been done only on mice, not on humans. So these studies proved that niacin supplementation upregulates this axis, and when we do administer niacin to the mice that have an ischemic brain, so they've had a stroke, then it is the BDNF factor is able to repair what has been damaged by this stroke and to a certain extent. Okay, so on this slide, I'm going to address niacin deficiency. We have covered it a little bit throughout our book and our PowerPoint in this class, but I just want to make sure that we understand how detrimental this can be to patients. And so some of the causes of niacin deficiency include decreased availability, malabsorption, and also medication interactions. So we want to take that information with us into our careers, as we wouldn't expect someone in America to have niacin deficiency. It's very rare because we do have food sources that have fortification and just naturally contain niacin available to us. However, we have to consider medications that one may be taking, as we don't want niacin to progress into something like dementia. So the niacin deficiency name is pellagra. Its appearance is scaly and hyperpigmented skin. Neurologically, patients will experience headache, fatigue, disorientation, paralysis, and again, loss of memory into dementia. And so the GI tract also has mucosal inflammation throughout the entire tract, which may cause nausea, vomiting, diarrhea. And if we think about this mucosal inflammation, their mouth is inflamed, their tongue is inflamed, it probably hurts to eat. So they're probably going to decrease what they're intaking, which is going to decrease niacin even more, which we don't want. And then the picture that I've included is a man with pellagra, and what he has around his neck, they refer to as a necklace of pellagra deficiency. And the skin first starts out looking like a sunburn, but then it goes into looking, again, hyperpigmented, scaly, and cracked. Okay, so I wanted to add sort of an interesting slide to this PowerPoint just to make it a little more light. So I have included the process of nixtamalization, which is common among Mexico and Central America. And so these populations eat a lot of maize. However, we don't see the niacin deficiency as often as we would in other underdeveloped countries because of this process of nixtamalization. So this is the process of soaking maize in a calcium hydroxide solution on heat, which is also known as lime water. And afterward, the kernel is peeled away from the maize, and then they use the insides to create a dough that they use in cooking. So the importance of this process to niacin is that it denatures the proteins of the maize in order to release niacin from the peptide bond, which we spoke of on the first slide. And this makes the niacin more accessible to absorption. And some of the other benefits are increased calcium content, increased dietary fiber, and also increased bioavailability of iron. The picture that I've included is just the process of heating the lime water with the maize in order to break that protein down. Okay, so now we're finishing up this slideshow, and I just wanted to reiterate my important information. So niacin is important for your skin health, cardiovascular health, cell repair, and also your central nervous system health. And then I also wanted to consider some of the future research. I think there's still a lot of research to be done, especially with niacin in the central nervous system. And something I would really like to see is more research done on the human central nervous system as opposed to mice. However, I think part of the problem here is the ethics of it all. So as healthcare professionals, I think it is vital to understand the importance of niacin, as deficiencies can be very detrimental to our patients. And then we also need to recognize the signs and symptoms of niacin deficiency. That way we can catch it and correct it. And then also I think it's important to know recommendations for food sources of niacin. I hope that you've learned something, and I hope that you've enjoyed this presentation.